All right. Well, hello, everyone. Welcome to this discussion of the Minnesota Sexual Orientation and Gender Identity Standards of Inclusion for Health and Human Service Providers. Thank you so much for participating today in our discussion. My name is Lavelle Trahan. I'm a contract worker with Rainbow Health Initiative to coordinate this project. So just to give you an overview of what we're going to be doing today, I have done introductions. I'm going to be giving a brief history of the Standards of Inclusion, its inception and where it is now, and then discuss the purpose of the document. And then we'll head into really what is the central point of our talk today, which is the recommendations and discussing them. So just to give you some history, in May of 2015, Rainbow Health Initiative received a grant from the Bush Foundation to address health disparities within the LGBTQ community within Minnesota. As most of you know, although Minnesota has very strong protections for LGBTQ individuals within the state, we still see discrimination, particularly within Greater Minnesota. And some of this discrimination is based on the fact that some providers may not have all the information, may not have all the tools or the training that they need in order to provide inclusive care to all Minnesotans. And so with this grant, RHI has decided to develop the Standards of Inclusion, which will act as a guide for providers. I came onto the project in August of 2015, and myself and EJ Olson, who was the manager of the project at the time, we initially did a literature review to review national models and projects that other states have been doing to compare across borders and to inform our project, as well as doing some strategic planning around how we're going to be implementing the Standards of Inclusion. A month later, we convened our advisory board, which you see to the right here on the screen. And the advisory board is made up of providers throughout the state. They come from various different health backgrounds and different programmatic backgrounds. And they're really bringing their expertise and knowledge to this project to take the national models that we found and interpret them in a Minnesota context. So they've been meeting quarterly, and right now, they've been providing their input. And right now, our goal for tonight is to give the community an opportunity to see the kind of high-level description of the document and to provide some feedback into its ongoing development. And so the purpose of the document is to provide a set of recommendations for implementing inclusive practice for health and human service providers. Now, what does that mean? That means we're developing a set of guidelines based off of standards throughout the country, but also specific to Minnesota, which can inform providers to implement inclusive practice within their care settings. The main document serves as a all-encompassing policy document with background literature, the recommendations, and some other historical impacts. From that, we also have the executive summary, which serves as a high-level kind of one-pager to inform legislators and other decision makers within different health providers to help them to understand what this document is for and how to kind of implement it moving forward. And then the user guide takes all of the information from the Standards of Inclusion and kind of brings down takes out the jargon, brings it to a very day-to-day level, and provides step-by-step instructions for providers throughout the state to implement inclusive care in their practice, and provides them with tools, case studies, and other information to help that process along. So we're getting to the recommendations. I like to think of the recommendations as the 3 E's. So environment, education, and experience. And while these three things are separate, they all feed into each other to create a comprehensive set of guidelines. The first of these recommendations is around the environment, and this is specifically the actual care facility that patients or clients are walking into. Many times, this is the organization's first opportunity to highlight inclusive care, and many LGBTQ individuals are on the lookout for signs that providers are inclusive, and if not, they will quickly go out the other door. So one of the first things that's necessary is for providers to make sure that their care facilities are accessible to all, particularly around ADA compliance, and making sure that all of the services within the facility, including websites, media, and the actual physical grounds are accessible in every way, shape, and form that is dictated by regulations. Building off of that is this idea of signage. And we recommend that providers have prominently displayed patients' Bill of Rights that inform patients of their rights, inform patients of non-discrimination policies and their recourses therein. We also recommend that there is accessible LGBTQ health information within, say, lobbies or other areas of a care facility, so that way patients can feel connected and they see that they're reflected within the information provided. And then also having inclusive media representation. And so this is making sure that in any media pieces that are going out, any kind of posters within the facility, that you represent LGBTQ individuals in them, so that way our community can see themselves represented in your outreach to us. Additionally, we recommend the building of inclusive restrooms. We recommend that all providers have all gender bathrooms, either multi-stall or single stall, so that way everyone, regardless of their gender identity, will have access to a restroom, and that the signage for those bathrooms be devoid of any kind of gender-specific imagery. Along with that, we also recommend that there be all-gender shower facilities or locker rooms if they're accessible for employees or for clients as well. We also recommend that providers hire and retain a diverse workforce through inclusive hiring practices by reaching out to particular communities which may have not been part of the employment process in the past, that they really think outside of the box of how they're going to attract talent from different communities, and then really kind of do some internal dialogues around how do we build inclusive workplaces for our employees so they feel supported to provide care to our patients and clients. And so making sure that they have concrete non-discrimination policies, that benefits for employees are inclusive for, say, same gender partnerships or domestic unions, domestic partnerships or civil unions, that you provide a wide plethora of benefits depending on how your employees express their own identities. And then you also have concrete guidelines for transitioning employees, so that way as they go through their transition, that they feel supported, that they understand their role within the organization, and that they have resources to reach out to. And also making sure that you implement some evaluation and assessment of your inclusive policies within your care setting to make sure that you are staying ahead of the curve and making sure that that your staff feel supported, that they have a way to provide feedback and recommendations to leadership for further improvement. So some of the things we're asking you as the audience to contribute is to let us know what your initial reactions to these recommendations are. Tell us what connects with your experience, either receiving care or providing care to patients and clients. And also, what do you think is missing from these sets of recommendations? We recognize that these are not by no means all of the recommendations that should exist, but we recognize that there could be more that we could add and build from, and so we turn to you for that input. Our next set of recommendations are around education. And I want to be clear that when I say providers, I mean everything from medical care, mental health, homeless care, you name it, as long as it supports LGBTQ individuals through the continuum of care of their lives. And when we talk about education here, we're talking about everybody within a care setting. So we're talking about actual direct service providers, such as physicians, nurses, et cetera, to frontline staff, receptionists, customer service, right down to the janitors, to make sure that you have comprehensive, culturally responsive staff throughout your organization, because you never know who's going to be interacting with a patient. And so at the core of this is a set of core curriculum around cultural responsive training, such as cultural awareness, awareness of internal bias, information about LGBTQ health and sexual orientation and gender identity, culture and responsiveness, as well as various communication methods to reach out to patients and clients with inclusive language, and be cognizant that you're not communicating microaggressions, and that you're providing a safe space for patients and clients. And then off of that is recommendations around profession-specific curriculum. So this would be for curriculum around particular jobs, roles, responsibilities within care settings, and how LGBTQ health relates to that particular position, and how that particular person can provide responsive and inclusive care to LGBTQ individuals. And so some of that is around like some of the things I mentioned before, but also around health disparities that our community faces, around mental health or cancer rates or obesity, for example, and having the tools to communicate that and to understand the cultural complexity that is our community. And then also, as a subset of that, we recommend that licensing boards for providers include some requirements around culturally responsive care for LGBTQ individuals. Often many licensing boards, particularly within Minnesota, have requirements around culturally responsive care for the people applying for licensure. However, they leave the cultural community up to the provider to decide. And so often, because our community is, our population is smaller than the average, the general population, many providers choose other cultural communities over ours. And so we're recommending that there be specific stated language around LGBTQ cultural responsive training. And then also requiring continuing education credits for providers to maintain their licensure moving forward, and that they annually must receive some type of sexual orientation, gender identity, or LGBTQ training. We've seen this modeled in other places such as DC and California with some success, and we believe that it would work well here in Minnesota. And then lastly, provider agencies should do evaluation assessment of the competencies of their staff to make sure that they are maintaining the appropriate level to provide inclusive care, and then also to inform any kind of improvements that needs to take place in case there are gaps or miscommunications. And so again, we're asking you, the audience, to provide us with your input. What are your initial reactions to these recommendations? What connects with your experience, either providing or receiving care? And then what do you think is missing from these recommendations? And our last area of recommendations is around experience. And this gets specifically to LGBTQ patients and clients. One of the first things that our community members, one of the first exposures they have is through an intake process. And often this can be filled with microaggressions and some problems because of the lack of inclusive language, the assumption of gender identity, the limitations therein. And so we recommend that providers update their intake forms to have inclusive language, particularly gathering information about sexual orientation, gender identity, sex at birth, preferred pronouns, partner status, etc. And that this be keyed into inclusive electronic medical records and client management systems. And this is important because one of the things we see across the state is that there's a lack of information about LGBTQ patients because we're not collecting that data within healthcare settings. And so by improving the intake process and improving our electronic medical records, we can start to build cases and understand how our population interacts with healthcare within Minnesota. And then also, with the electronic medical record systems and the client management systems, there should be alerts and flags for providers for preferred pronoun, for partner status, and other things that are important for the provider to know to incorporate into the care of the particular patient or client. Additionally, after visits, patients should be provided with satisfaction surveys to inform quality improvement within the care setting. And then in addition to a quality improvement process through the patient satisfaction surveys, is the development of patient advisory groups and direct LGBTQ community engagement. And the patient advisory groups really serve as a quality check within the community about the care that you are providing. They can serve either on the board or as a separate entity. It can really inform gaps or areas for improvement and really help to incorporate the viewpoints of our community. And then specific LGBTQ community engagement is around authentic engagement with our community through either media outreach, collective work, campaigns around health and fitness, etc. And that you respect our community and you bring us to the table as equal partners and support us through this journey of health. And so again, we are asking you, the audience, to provide your initial reactions. Tell us what connects with your experience of accessing or providing care in health settings. And then let us know what is missing from these recommendations. So in conclusion, based off of the information provided by you, the audience, we will incorporate this into the existing standards of inclusion. It will go for a final review with our advisory board next month. And then after that, we should have a concrete, complete document, which we can then share with our communities. So with that, I'd like to say thank you so much for participating, and I look forward to hearing your thoughts.